Should we force dentists to take on more NHS patients? Now, an investigation by the Mirror has found that virtually no dentists in England are taking on new patients. This is despite the fact that the £200 million rescue package was announced in February, which was meant to open up more appointments. Now, the then Conservative government planned to bring in mobile dental vans and offer dentists financial incentives in order to relocate in underserved areas. Neither of those goals have been met. So do we need to make dental surgeries take on more patients? Maybe we should bring in quotas for the number of NHS patients that they see, or maybe it just comes down to more money. Get your calls in now, whatever your view. 0207 862 2222 is that number again. Lynn, what do you think? Making dentists take on more NHS patients?
I think when we talk about teeth and dentistry in general, I think it's one of the easiest things to prevent as a person, whether you have money or don't have money. You know, and I think there is a lack of desire to want to look after your teeth. We can even see with many children who attend school, teachers are saying, you know, why are children coming to school where they're not even brushing their teeth? And there was a discussion where should we start brushing children's teeth in the school? So my thing is, you know, when you look at how much it costs to train a dentist, it's between £200,000 and £300,000. They need to recoup that. It's a hugely skilled profession. So to say, shall we force them? How do you go about forcing a highly skilled, trained individual who can get, let's say, for example, for a filling, £950 privately, but on the NHS, £306.80? Why would you go for that?
Well, I mean, just to correct you there, about £200,000 of the money that it costs for them to study, they don't have to repay. But it is still very expensive to study to be a dentist. And actually, they do have to pay that money back.
Does the government pay it?
The government, yeah, there's like a bursary involved.
And that's only if you become an NHS dentist, not if you go private?
No, both. So that would be the question of, should we say, well, the taxpayer is funding part of your education, therefore you have to work as an NHS dentist for 3 years after qualifying. That could be one of the policies. But then what happens
after the 3 years? I think, yes, you should. If the government is paying for your training, absolutely, you should give some years. But once that's essentially like paid for or given back via them working, what is there to force them to try and be an NHS dentist?
What do you think, Emily?
Well, I think it's very tricky, isn't it? Because obviously what was announced by the Conservatives and the last government, I mean, I think they promised that, this was in February, the Conservative government promised that everyone who needs to see a dentist will be able to do so during 2024 and 2025. I mean, that's patently not obviously going to happen. So it's a massive problem. And obviously it's the National Audit Office has said that this dental recovery plan is basically for the birds. It's just not going to work. It is a massive problem. I think there are many reasons for this. I think dentists have been hit with a double whammy of cost of living crisis. I think there aren't enough dentists. There's a shortage in training. And also, you know, I think 90%, I think I read that up to 90% of practices are not accepting new NHS patients. And so I think it's very, very difficult for dentists. I don't see how they can be forced to accept new patients if they're at capacity. I mean, we're all as men and women, we only have a certain amount of hours in the day, don't we? And so I think that it's a really big problem that the current government really has to get to grips with, and get to grips with quickly. Because I mean, often in this programme we talk about DIY dentistry, don't we? And people going abroad to Turkey or wherever other countries are available for, you know, much cheaper dentistry.
Or we just say, actually, the government cannot pay for every person, every tooth in every person's head, that we're going to have to take responsibility for that, which is kind of what Lynn is getting to. I want to bring in now Dr. Nilesh Parmar, who has 2 clinics. Both are NHS and private, so it's a sort of combi clinic. Is that predominantly what we see around the country, that dentists are both private and NHS?
Hi ladies, thanks very much for having me on your show. Storm is such an interesting and sad topic to speak upon, and yes, so a few points that you raised. The idea of forcing dentists to work on the health service because their education is partly funded by the government. It is true, it is funded, but so is medicine, lawyers, architects. Every professional university program is co-funded by the government. I would recount that argument and say, when we're training as dentists, we are doing free treatment in dental hospitals for at least 3 years. So there is a push and shove argument that, however, coming to the NHS contract, dental practices, I think there's such a misunderstanding of how much it costs to run a dental practice. So the current contract works on the UDA system, and that system, British Dental Association, British Association of Private Dentists, every dental organisation has said it's not fit for purpose. And that's the sort of phrase that we use, because the work is not remunerated fairly for NHS dentists, which is why almost all dental practices, how do they remain solvent? Because they're all privately owned businesses, they offer private care. And it's the private care which we offer, which subsidises NHS dentistry. And that is becoming more and more of an issue. Some numbers for you.
Could I just ask a quick question, just for sort of people watching? So if say, how much is an average dental appointment? Average. I want to come and have my teeth
like
checked.
a checkup.
I want to
75 for private.
In private.
If you're talking about NHS checkup, it's about £25, £28.
But if I come privately,
privately could range from £60 to £120 plus.
And out of that, how much do you reckon of that is used to subsidise the NHS patients in your care? Out of sort of what?
So
50%?
I would say 50% would subsidise.
Okay.
So we're in a situation now where most practices across the country are surviving by charging their private patients more to subsidise the NHS. So it's almost a double tax on those that are going private, because they're paying their taxes for the NHS, but they're also paying additional price.
Yeah, but the product isn't the same, Storm. So when you have a private checkup, you're spending a lot longer with the patient. You're going through the options much more. You're taking photographs, you're taking videos. It's a much longer appointment, right? Whereas when it's an NHS appointment, it's a very shortened appointment because the remuneration is so low. So the main issue here is the funding, and how is the funding given to NHS dentists? We've had a drop in funding, right? About 20%, and the way the funding is delivered. So I don't know if you know how NHS dentists are paid. So if you do 1 filling or 10 fillings for an NHS patient, the dentist is paid the same, and it's not really sustainable.
Okay, Nilesh, stay with us. I'm just going to take some calls now. Kathy from Lancashire, have you had trouble getting hold of a dentist?
I had to go private, and I'm not happy with it. What does an NHS dentist get paid compared to a private dentist, please? I don't know who the gentleman was. I missed his name.
It's Dr. Nilesh. Dr. Nilesh, are there any, that might be quite a hard question to answer, Kathy, because from what we're discussing here, most dentists across the country do both NHS and private, and it's the only way that they can take on NHS patients is if they're also taking on private patients. But would you know roughly if someone was exclusively treating people privately in dentistry, how much they would be getting a year? I suppose that's what you're asking, Kathy?
It's such a difficult figure. It's like saying how much does a newsreader make per year? It depends upon the dentist, the speciality, where they are. All I can say is the current NHS contract and how much NHS dentists are paid is quite easy to figure out. To give you an idea, for an NHS checkup, a dentist is paid about £12 to £15. The NHS dentist who doesn't own the practice, that's how much they would take home. If you work out how much it costs to run a dental chair, like the one behind me, is about £100 an hour is how much it would cost to run that dental chair with the staff, the nurse, the insurances, etc. So you can see where there's a disparity there.
So the very basic principle of this whole argument is dentists are saying, Kathy, that the government are just not paying them enough per NHS appointment. They're not making enough money to actually just pay for the basics of what they're doing. Do you accept that?
Excuse me for asking. Are they expecting too much?
But Kathy, if you're providing a service that has a cost to it, and the person that's getting the service isn't paying you enough to even cover that cost, then there's no way of sustaining that unless you're accessing cash elsewhere. And in dentistry, they're saying that they're doing that with private patients.
Right, I've got it now. But why aren't the NHS being paid then? That's the government, I understand that now. Well, the government needs to put their hand in the pocket. They can pay the junior doctors and they can pay the train drivers. then they need to pay the dentist.
But the question is whether they have enough money to be able to do that, Kathy. And I suppose, Nilesh, in your view, as a practicing dentist, do you think there's going to come a time where the government's going to have to put up their hands and say, look, we just can't afford your dentistry bill. We can't afford to pay for every tooth in everybody's head across the land. You're going to have to pay for it yourself.
Yeah, Kathy, Storm, I really feel for Kathy, and I understand where she's coming from. And dental practices are privately owned businesses. If we're not paid enough, we can't remain open. The government has to make up its mind. Does it want to privatise dentistry, or does it want to improve it? We have the potential, we have the dentists and the nurses and the hygienists to make NHS dentistry in the UK the best dental system in the world, but it just needs to be funded appropriately, which they've not been doing.
Do we have enough dentists? Because that seems to be part of the problem, that there's not actually enough dentists to take on all the need.
Yeah, so Storm, so since Brexit, we lost a lot of NHS dentists because a lot of the NHS dentists came from mainland Europe because they could work here, make money in pounds and send that money back. If you speak to any newly qualified dentist, they do not see their future in the health service. They don't want to work in NHS dentistry because of the confines it puts on dentists. They want to work in the private sector where they can spend their time, do as much work or as little work as they want. They want the flexibility. So recruitment, for me, to get a full-time NHS dentist is very, very, very difficult. We do struggle with dental recruitment in this sector.
Okay, and part of that is the constraints over finance.
As well ourselves. Do you see there is an increase of maybe children having to see the dentist, or maybe are you seeing less hygiene, mouth care that we can do as a nation, so we don't have to come for these appointments? Because I'm sure a person who is relying on the NHS tends to only leave it when it's an emergency.
Yeah, so one thing the NHS system doesn't reward or pay dentists a lot for is hygiene or prevention or hygienist visits or things like that. And we are now seeing record number of children being sent to hospital for general anaesthesia to have teeth removed. And that was in the news earlier on this year. So we do find that with the increase in sport drinks, vaping, smoking, that is all affecting the nation's health. And you are right, a lot of people come to us when it's just too late, and we do end up removing teeth as opposed to giving them preventative advice.
Okay, going back to the calls. Alison from Berkshire, what's your view on dentistry? Should we be forcing dentists to take on more NHS patients? Is that even going to work?
Yes, they should. Because I've in the last few years, I've pulled out 5 of my teeth so far. I've got very few left now, and I don't know what to do.
Well, Alison, you've definitely come up with a solution of some sorts. You've pulled out 5 of your own teeth. Were we talking string on the door situation here, or?
No, pliers.
Oh my goodness. Okay, that's made my whole body feel funny. Alison, that's not a situation we want anyone in at all. And this was because you couldn't find a dentist?
Yes, yes.
What a sad state of affairs. Now, Nilesh's argument to you would be he can't take on, or not just him specifically, we're talking about dentists in general, can't take on any more NHS patients because, quite frankly, the government aren't paying him to do it. So is your problem with dentists, or is your problem with the government?
Oh, God. It always boils down to the bloody government, doesn't it? Sorry, French. Sorry.
No, excuse your French, that's all right. It always boils down to money, I think, is the bottom line, and things cost money, and dental care costs money. So, yeah, I suppose it does always come down to what the government's going to put in their hands in their pocket and pay for.
Yeah. I mean, I think it should be available at the point of need.
Yeah. That's not been dentistry for a very long time, though, Alison, and that might be just the way things are going if we don't make some changes.
Could I ask Dr. Nilesh, hello, it's Emily here, Dr. Nilesh, could I ask, I mean, what is the solution here? Is the solution the government giving the NHS part of dentistry, a lot more money per patient, is the solution to, because that's my inference from what you're saying, that we can train more dentists, but they're not going to want to stay working within the NHS because it's better to work in the private, not just because of more money, but because of, obviously, as you say, you want to spend more time with your patients. You want to have that bandwidth to be able to do your notes or whatever and spend the time with each person. Does it just come down to the government has to put its hands in its pocket and pay more per patient to every NHS dentist?
It's not as simple as that, I would say. I think they need to change the entire system in itself. Is to pay dentists for the work they do instead of trying to put it in bands. That would help. That would involve spending more on it. But also, and I have a lot of sympathy for these patients who take out their own teeth and they suffer, and they shouldn't have to suffer in this country. But also look at the dentists. We have a huge recruitment issue. We have a mental health issue with dentists. Dentists in the UK get sued more than any other healthcare profession in the world. And we have one of the highest suicide rates in any profession as well. So I think we also need to look after our dentists as well and say to them, look, maybe we can offer you indemnity, so Crown indemnity, to protect us against malpractice suits, to help us get through difficult times, because only then will we have a sustainable workforce that can offer the dentistry that the population needs. Yes, it's more money, but it's also working conditions, working environment, and also working on the public perception of dentists as well. Because how many dentists know that patients come in and say to them, I hate the dentist, and you hear that on a regular basis. It does affect the mental health of the dentist as well.
Oh, that makes me feel terrible, because I don't particularly like going to the dentist. It's not my dentist I have a problem with, it's just the drills that go in my mouth that are necessary. But I understand that that's something we'll consider. Dr. Nilesh, thank you very much for your time, and thanks for joining us for that conversation. Thank you for all your calls as well. We're going to be talking about calorie